Now we're beginning to see an easing of coronavirus restrictions around the country as case numbers reduce, but around the world there are more than 3 million people infected.
Governments have been grappling with the impacts and now attention is turning to whether their responses are working. There have been heartbreaking scenes around the world. Hospitals at breaking point, families devastated, health workers exhausted and overwhelmed. It's the grim reality of coronavirus. Different countries have taken different strategies to control and contain the spread. So what's working and what's not?
That's an interesting question, but I think we have to wait 1 year until we say who's done right and who's done wrong here.
One of the current ways to measure the success of strategies is to look at how many patients have died for every 100,000 people in the population. In the US, the mortality rate is 16 people. In Sweden, 21. In Australia, the rate is very low. Australia's response to coronavirus is held in very high regard internationally. Experts say we've controlled the disease really well. Our strategy is suppression until there's a vaccine. We've kept the case fatality rate down and haven't exceeded our health system's capacity. It's a very different situation in other parts of the world. In Sweden, there are no lockdowns. Schools are open for under 16s. Social distancing is voluntary, although crowds must be less than 50 people. Restaurants and bars are open, but older citizens are advised to stay in.
The headline is "People are not stupid." If you tell them what is best for them, what's best for their family and what's best for other people, they will usually do as you tell them if they feel that it's reasonable. So that there are far less laws and policing in Sweden than in other countries.
At the beginning of this pandemic, Singapore was lauded for its quick response and sophisticated contact tracing. Initially, it closed borders to populations likely to be infected. Businesses stayed open, schools had health checks for students, there was testing available and free treatment for residents. But now Singapore has one of the highest caseloads in Southeast Asia. It neglected the crowded dorms where migrant workers live, and Covid-19 is now rife in those camps. The United States is the world leader in total case numbers, but not in its response.
What's happened in the United States is an absolute tragedy, and it's shocking to see the most technologically advanced country in the world stumble so badly and have such a huge epidemic there.
The United States had issues with availability of tests as officials scrambled to find enough personal protective equipment. There was a fragmented response across the country and no national plan. President Donald Trump initially downplayed coronavirus. Political differences have plagued the response, and now in some states Americans are protesting, citing an infringement of civil liberties. New Zealand's PM Jacinda Ardern took a strict approach from the start, aiming to eliminate coronavirus within the country's borders. There's been a strict lockdown since March. Schools are closed. People are only allowed to leave home for groceries or exercise. Only this week, some restrictions are easing. As case numbers keep climbing across the world, researchers are working hard and fast to develop a vaccine.
Herd immunity is something you can really only get with vaccines. Otherwise, we wouldn't have any infectious diseases in the world, would we? Because we couldn't control measles, rubella, smallpox or any of those diseases until we got a vaccine. And that's exactly what it will be like with COVID-19.
Interesting stats, aren't they? Different responses.